Are you curious about intermittent fasting? How do you get started and what are all the rules? Today I'm going to show you exactly what you need to do. I've also created an intermittent fasting cheat sheet that I hand out to all of my patients trying to lose weight. And I've placed the link below in the description for those of you who would also like a free copy. If it's your first time here, I'm Dr. Majd, your YouTube family doctor, here to review what you really need to know about the latest medical topics, news, and headlines. So last week, I reviewed the pillars of the book written by Dr. Fung. In order to make intermittent fasting work, I really think we all need to understand why. So listening to that video is really important if you're considering intermittent fasting. So I'll place a link to that below as well. The culprit: elevated circulating insulin levels. All foods increase insulin to some extent. Yes, even protein and fat. So if we want to achieve weight loss, we need to figure out how to suppress those insulin levels in our body for prolonged periods of time and do that frequently, meaning intermittently. Well, there are several versions. The easiest to start with, and perhaps the most popular version, is a 16-8 schedule. Select a 16-hour window of time where you will fast, and the remaining 8 hours will be your eating window. For example, if you stop eating at about 8 p.m. at night, you'll be fasting all the way until 8 a.m. the next day and 4 more hours. So you'll break your fast at noon. Honestly, we all fast when we sleep. All you have to do, you just add 4 more hours. Now, then you'll be able to eat from 12 to 8 p.m. But of course you can choose like any 16-hour time frame that works best for your schedule and for your lifestyle. Now, the longer that you've been overweight, the longer this regimen will take to downregulate your insulin levels, especially for people who are diabetics, pre-diabetics, or suffer from something called polycystic ovarian syndrome or PCOS. Now, there are 2 other more stringent versions that are often used for these patients who want to speed it up. However, it's going to take a longer fasting time period in order for you to achieve it. So one option is the 24-hour fast, which means that you'll skip 2 meals. So let's say tonight you'll eat at 7 p.m., you'll eat your dinner, and then tomorrow you'll skip breakfast and you'll skip lunch, but then you'll have dinner again that evening. And the third option is a 36-hour fast, where you will skip 3 meals. So that means tonight you'll eat at 7 p.m., and then tomorrow you'll skip breakfast, lunch, and dinner, but then eat breakfast the following day. Now, for the 24 and 36-hour fast, you can consider doing it about 2 or 3 times a week and not every day. And then eventually you may get to a point where you lose enough weight that you can actually back off and do a 16-8 every day or on most days of the week. And then long term, we can even get to a point where we do the 16-8 maybe every other day or several times a week and keep that up long term. Now, during that fasting period, you can have coffee, you can have tea, you can have water or sparkling water. You just want to avoid putting anything in there. So that includes things like sugar, honey, the sweetened creamers or milk. You can put some minute amount of high-fat creamer in there if you must, but it's best to go even without that. Now, during the 8-hour eating period, you can continue to eat how you normally would during those 8 hours, however, to improve your overall health and increase your weight loss efforts even more. You can try to follow these tips as much as possible. Here we go. First of all, I should say, do not overeat during these 8 hours because that may mitigate all of your efforts for during the daytime. Avoid snacking in between meals. So you can have your lunch and you can have your dinner, but don't snack in between. Avoid processed foods and refined sugars, things like bread, potatoes, pasta, rice, sweets, etc. And opt for carbohydrates with a lower insulin index level. That's a new term that you may not have heard, which means those that don't stimulate insulin release as much as white carbs do. I'll place a link to an insulin index list in the description down below. No juice. Yes, even if it's natural. People ask me that all the time. Nobody needs juice. No children need juice. No adults need it. Nobody. No sodas too. Same thing. No drinks with any carbohydrates at all. Read the food labels of the liquids to make sure, because they can sneak them in there and you wouldn't even know. No artificial sweeteners. They actually stimulate insulin just as much. Avoid anything with high fructose corn syrup and sucrose. These sugars are exceptionally fattening. Increased consumption of natural, unprocessed fats, which stimulate insulin, release the least out of the three main dietary components, meaning protein, carbs, and fat. This means opt for things like avocados, or like full-fat dairy or nuts. Use extra virgin olive oil or butter for cooking and nothing else. Avoid refined oils, meaning trans fats, canola oil, corn oil, vegetable oil, except for olive oil. Avoid processed lunch meats like sausage, bacon, pepperoni. Increase your fiber. It reduces the risk of diabetes and it controls blood glucose levels in diabetics. Opt for carbs that contain high fiber like fruits and veggies. No more than 2 alcoholic drinks a day. But avoid dessert wines and the mixed drinks. Beer is actually fine, but red wine is best. You can reward yourself with a dessert or other desirable food, but no more than once a week. No more. I've reviewed more do's and don'ts of intermittent fasting if you want to learn even more in my patient handout. The link to a free copy of it for my listeners will be in the description down below if you'd like one. So if you found the information here valuable, which honestly is always my goal, give it a like and hit that red subscribe button along with that notification bell next to it so that you don't miss any weekly videos. And please feel free to share it with someone else who may find it useful. Well, thanks again for watching another one of my videos. I'll come back next week with another review of a medical topic, news, or headline. Catch you then.